Welcome back. This section of the show is called Ask FPA. You can send your questions to tv@fpalex.com and include your name if you would like us to use it on the air. Tonight's question is, which is better, traditional Medicare or a Medicare Advantage plan, asked by Ann in Lexington, Kentucky. And here to help us answer that question at open enrollment time when you have to make some choices of your insurance is Mr. Craig Gillespie, our CEO at Family Practice Associates. Welcome.
Thank you.
All right, what is the difference between Medicare Advantage and regular Medicare?
So you're really talking about Part B Medicare. So Part B Medicare is what would cover office visits, diagnostic testing, those kind of things. So traditional Medicare is going to be just the Medicare you get from the government. So it will have a premium you have to pay. There's a deductible that comes with that, an 80/20 co-insurance. And the big advantage to traditional Medicare is it's an open network. So you can go to any doctor, any provider. You don't have referrals, you don't have prior authorizations. Medicare Advantage, on the other hand, is going to be structured a little more like a traditional PPO plan or your insurance plan. You'll still have to pay your premiums that you pay for Medicare, but you'll be able to get, with Medicare Advantage plans, you'll be able to get additional benefits from one of those carriers that some people may find advantage to. So it may have a traditional copay, it may pay for part of the deductible. So those are kind of the things you have to look at. It's what might be important to you. One of the big differences with traditional Medicare versus Medicare Advantage is a preventive care visit or a physical, an annual physical. So Medicare traditionally does not pay for an annual physical where you have nothing wrong with you and you're just going to the doctor for a checkup. Medicare Advantage plans typically do cover that, and they typically cover that at zero copay. So that may be something, when you're looking at the plans to weigh one versus the other, that might be worth looking into.
Now, you mentioned the term when you were describing differences. You used the term deductible. And for those of us who work in healthcare, we know what that is, but explain that to patients who are trying to pick an insurance plan.
So deductible is basically the dollar amount that the insurance says that you have to meet out of your own pocket first before they'll ever start paying a dime. So typically, now we're hearing about more of these high deductible plans. So high deductible plans are going to have, $1,500 deductibles or even higher. Some go as high as, $4,000 or $5,000, maybe even $8,000 to $10,000 if it's a family plan. So if you have whatever plan you have that has a deductible, you have to meet that deductible out of your own pocket before they'll start paying anything. And once they start paying, then they'll start charging you co-pays, and you may have co-insurance still. But that first dollar amount that you have to pay is your deductible, and that can be pretty hefty.
So if you have a high deductible, you can use an HSA to help cover that.
Yes.
Explain what HSA stands for and how you do it.
It's a health savings account. So a health savings account you have to use with a high deductible plan, and there's some specifications on how high it has to be. But typically with an HSA, you can put your own money into it. An individual can put $3,500, I believe, and $7,100 a year for a family. And then that allows you to pay for those expenses, those deductibles, and the other things that you're going to have with that HSA money that was done pre-tax. And that's the biggest benefit for the HSA. It's all pre-tax dollars, and it'll lower your tax income bracket. You'll be able to put that into an account where you can pay for some of those expenses.
If you don't use it, you can carry it over for a long time.
Yes, and you can really use it for any health-related benefit, prescriptions, co-pays. The only thing you can't use it for health-related is to pay the premium. And one advantage to that, the HSA with the deductibles versus a PPO plan, is once you meet your deductible, then of course they'll start paying. But on a PPO plan, if you may have a $1,500 deductible with a PPO plan, but every copay that you pay and every coinsurance, that does not apply to the deductible. So that's additional out-of-pocket expense versus your deductible. So it may be to your advantage to have an HSA, because every dollar you pay goes towards that deductible, and you'll spend a little bit less before they start paying, if that makes any sense.
Now, it's important, though, that all these things you've gone through is to know your plan.
Yes.
And know what it covers or what's the best options for you.
Yeah, and that's really the patient's responsibility to know what's in the plan. I know that's difficult because it's very confusing sometimes, but it takes a little time to sit and go through it. But you should be a smart consumer and price shop and find out what that X-ray or that CT scan is going to cost. and use your best judgment with that. One of the things with ERs versus UTCs and PCPs, I mean, typically you're going to pay more to go to an urgent treatment center or an ER versus your primary care doctor. So you should always start with your primary care doctor because you're going to pay a copay, and you may not need to go to an ER or UTC, but you're always going to pay more than.
It's great information. So if you're looking at an insurance plan, make sure you explore all the options. We'll be right back.